The nurse pulled back the blanket and froze. For 15 years, the woman lying in that bed had never spoken a word. She had been only 6 years old when a devastating brain injury left her with a prolonged disorder of consciousness. Now she was 21, and during her morning check, the nurse noticed something she had never seen before. The woman's abdomen was swollen. At first, she thought it was a complication from years of immobility. Then the woman suddenly began making strange sounds. The nurse checked her again. Something was definitely wrong. She called the doctor, and within minutes, they ordered an ultrasound. When the image appeared on the screen, the doctor stared at it without saying a word. Then he looked at the nurse. "How long has this been happening?" Nobody in the room had an answer, because the ultrasound had revealed something that shouldn't have been there. Who had been close enough to her for this to happen? This is Hidden Pathogens.
This is Hidden Pathogens?
For 15 years, Lena Simmons had been the patient everyone at the long-term neurological care facility outside Cheyenne, Wyoming, remembered. She had arrived there as a 6-year-old after a devastating brain injury. Now she was 21. But to Andrea Miller, she would always be the little girl whose mother used to sit beside her bed and whisper stories long after visiting hours were over. Andrea was 47 now, and she had worked at the facility for nearly 2 decades. She had watched Lena grow without ever hearing her say a single word. Every morning, Andrea followed the same routine. She would open the curtains, check Lena's breathing, straighten the blanket, and then lean close to her. "Good morning, Lena. I'm here." There was never an answer, but Andrea kept talking anyway. Sometimes she played the songs Lena's mother used to request when Lena was a child. Sometimes she told her about the weather outside, and sometimes, when the room was quiet, Andrea would simply sit beside her. She never knew how much Lena could understand. She only knew that abandoning her was not an option. Over the years, Lena's parents became too old to visit regularly. Then her mother died. Her father followed several years later. After that, Andrea became one of the few familiar faces left in Lena's world. She knew the smallest details about her. She knew when Lena's muscles became unusually tense. She knew which sounds usually meant discomfort. She knew what Lena looked like on an ordinary morning. And that was why, when Andrea walked into Lena's room one morning after several days away, she stopped almost immediately. Something looked different. Andrea stepped closer. She looked at Lena's face, then at the blanket, then back at her abdomen. She pulled the blanket down slightly. Her expression changed. "Lena?" For the first time that morning, Andrea felt something she couldn't explain. She reached for the call button. Then Lena made a strange sound. Andrea froze. It wasn't one of the familiar sounds she had heard hundreds of times before. This was different, strained, breathy, almost rhythmic. Andrea leaned closer. "Lena, are you hurting?" There was no answer. Then Andrea noticed something else. The blanket wasn't lying flat across Lena's abdomen. It was raised, not slightly, enough that Andrea could see the fabric lifting and falling with an unfamiliar contour beneath it. Her hand moved toward the blanket, then stopped. She had cared for Lena for years. She knew what Lena looked like after a meal, after therapy, after a restless night. This was not any of those things. Andrea slowly pulled the blanket down, and the moment she saw what was beneath it, the color drained from her face. What had changed inside Lena, and how long had it been happening without anyone knowing? Andrea didn't scream this time. She simply stepped backward. Her eyes remained fixed on Lena as one hand searched for the call button on the wall. "Doctor," she whispered. Her voice was so different that the nurse at the station outside immediately looked up. Andrea pressed the button again. "Get Dr. Harris, now." Within minutes, 2 nurses entered the room. One looked at Lena, then at Andrea, then back at Lena. "What happened?" Andrea couldn't answer at first. She pointed toward the bed. "I've never seen that before." The second nurse moved closer and carefully examined Lena's abdomen. Lena made another strained sound. Everyone stopped. It wasn't loud, but it was enough to make the room feel suddenly smaller. Dr. Harris arrived moments later. He had treated Lena for years, and he knew her medical history almost as well as Andrea did. "What are we looking at?" he asked. Andrea stepped aside. The doctor examined Lena's abdomen, first with his eyes, then gently with his hands. His expression changed. He asked when Andrea had first noticed the swelling. "This morning. Was she like this yesterday?" Andrea hesitated. "I wasn't here yesterday." Dr. Harris looked at the other nurse. "Did anyone document abdominal swelling?" She shook her head. He checked Lena's chart. Nothing. No recent diagnosis, no abdominal complaint, no documented injury, no explanation. Then he looked at Andrea. "How long has she been making those sounds?" "Only this morning." Dr. Harris ordered an ultrasound. While they prepared Lena, Andrea stayed beside the bed. She held Lena's hand. "I'm here," she whispered. For the first time, Andrea wasn't saying it just to comfort Lena. She was saying it because she needed to believe it herself. The ultrasound technician arrived and began scanning Lena's abdomen. At first, the screen showed only familiar shades of gray. The technician slowly moved the probe across Lena's abdomen, searching for an explanation for the swelling. Then she stopped. On the monitor, a distinct rounded structure appeared. It didn't look like part of the surrounding tissue, and then it moved. The technician froze. She adjusted the probe. The structure moved again, independently, with a slow, unmistakable motion. Her hand stopped. Dr. Harris noticed her expression. "What is it?" She didn't answer. She changed the angle. The structure disappeared. Then she found it again. There, moving separately from everything around it. Dr. Harris stepped closer to the monitor. "Freeze that." The technician did. For several seconds, nobody moved. Andrea looked from the screen to Lena. "What are you seeing?" Dr. Harris didn't answer. He simply stared at the monitor, because whatever had appeared on that screen was not a complication they had been expecting. And if the scan was showing what he thought it was showing, how could something this significant have remained hidden inside Lena for so long? Here's what happened inside Lena's body. Inside Lena's body, the change had not happened overnight. The ultrasound showed that the enlargement was coming from deep within the pelvis and lower abdomen, not simply from the skin or abdominal muscles. Dr. Harris watched as the technician moved the probe slowly across the screen. The image revealed an enlarged, fluid-filled space where the doctors would normally expect to see the uterus. Andrea stood beside the bed, watching the monitor without understanding what any of it meant. "Is that her uterus?" she asked. The technician nodded cautiously, but something about its appearance was unusual. The cavity was far larger than expected, and inside it was another distinct structure. Andrea looked at Lena. For years, she had helped care for her. She had watched her body change as she grew from a child into a young woman. She had never imagined that one day she would be standing beside her bed while doctors tried to explain something like this. The technician changed the angle of the probe. The structure became clearer. It wasn't simply a solid mass. There was a defined outer boundary. There was fluid surrounding it, and then it moved. Not with Lena's breathing, not with the movement of her intestines. It moved independently. Andrea's fingers tightened around Lena's hand. "Lena," the technician took another measurement, then another. She checked the image from several directions, making sure the apparent movement wasn't being caused by the ultrasound probe itself. It wasn't. Whatever was inside the enlarged uterine cavity was moving on its own. Dr. Harris leaned closer to the screen. He began looking at the surrounding anatomy. The uterus had expanded dramatically. The internal cavity was distended, and the structure inside it appeared organized rather than irregular. That distinction mattered. A simple collection of fluid would not normally produce the same pattern. Neither would an ordinary abdominal swelling, and a solid mass would not be expected to move independently in this way. Andrea watched the doctor's face. "Is it dangerous?" Dr. Harris didn't answer immediately. He asked the technician to measure the surrounding fluid and document the structure from several different views. Andrea's fear grew with every measurement. She had spent years wondering whether Lena could understand her. Now she found herself wondering something else. Had Lena's body been trying to tell them something for months? Maybe even longer? The doctors continued examining the images. The structure was contained within the enlarged uterus. Then the technician noticed something else. She slowed the scan and watched the monitor for several seconds. A faint, rhythmic movement appeared within the structure. It repeated, pause, movement, pause, movement. The technician checked the measurement again. Then she changed the angle of the probe and repeated it. The measurements were not consistent with a simple fluid collection or an ordinary static mass. Something inside the enlarged uterine cavity was developing in an organized way. Dr. Harris stared at the screen. Measure it again. The technician did. She recorded the dimensions and examined the surrounding fluid. Then she looked at the doctor. This has been developing for some time. Andrea felt her stomach tighten. For how long? Neither doctor answered immediately. Andrea looked at Lena's motionless face. For years, Lena's body had given them almost no way to know what she was experiencing. Now the ultrasound was showing them something that had been progressing silently inside her. Something alive, something developing, and something that should have raised questions long before that morning. Andrea squeezed Lena's hand. "I'm sorry," she whispered. Dr. Harris kept his eyes on the monitor. The measurements continued to change as the technician refined them. The pattern was becoming clearer. But there was still one question nobody in that room could answer. If this had been developing for months, how had no one noticed until now? Doctors didn't leave the ultrasound room. Instead, Dr. Harris asked for Lena's records. Not just the latest notes, everything. Her weight measurements, nursing observations, bathing records, medication changes, physical therapy notes, every routine examination from the previous year. Andrea helped spread the records across the desk. At first, nothing seemed connected. One entry from 8 months earlier showed a small increase in Lena's weight. Another, several weeks later, mentioned that her abdomen appeared slightly fuller than usual. Neither had seemed alarming. Lena's weight had fluctuated before. Her body had changed over the years. And because she couldn't explain what she was feeling, there was no way for a nurse to ask the usual questions. Was she nauseated? Did her abdomen hurt? Was she feeling pressure? Had anything changed? There were no answers. Then Andrea found another note. She stopped reading. Dr. Harris looked over. The note was from approximately 6 months earlier. It described Lena becoming unusually restless during repositioning. At the time, her vital signs had been normal. There had been no fever, no obvious injury. The episode had passed. So it had been documented and forgotten. But now it looked different. Dr. Harris placed the note beside the ultrasound measurements. "What's the date?" Andrea told him. He looked back at the scan, then at another record, then another. The clues were beginning to form a pattern. A gradual increase in weight, abdominal enlargement, changes during routine care, episodes of unusual vocalization. Nothing dramatic enough to trigger an emergency, but together they suggested that something had been changing for months. Dr. Harris ordered a more detailed ultrasound and asked the technician to calculate the developmental measurements again. The room became quiet as the technician worked. She measured the structure from several angles. She compared its size and development with established ultrasound dating standards. Then she entered the measurements into the system. A date range appeared on the screen. Dr. Harris stared at it. Andrea noticed his expression. "What?" He didn't answer immediately. He checked the measurements again. Then he repeated the calculation. The result remained essentially the same. The measurements suggested that whatever they were seeing had been developing for roughly 8 months. Andrea slowly looked at the calendar. 8 months. She counted backward, then stopped. That can't be right. Dr. Harris looked at her. Why? Andrea pointed toward the old nursing notes. Because the earliest changes they'd dismissed were from almost exactly that period. The weight gain. the abdominal fullness, the unexplained discomfort, the strange sounds. They hadn't been random events. They had been pieces of the same timeline. Andrea felt a cold sensation move through her chest. For months, Lena's body had been changing in front of them, and because each change had seemed minor on its own, nobody had recognized what the collection of clues meant. Andrea looked toward Lena's room. "She was showing us," she whispered. Dr. Harris didn't correct her. He simply closed the chart. The terrifying part wasn't that they had discovered something unexpected that morning. It was that the evidence suggested it had been developing for most of a year. And if the process had begun 8 months earlier, how had an entire hospital failed to recognize it for so long? The ultrasound room remained silent. Dr. Harris asked the technician to bring up the measurements again. He wanted to make sure they hadn't missed anything. The technician adjusted the image. There was the enlarged uterus, the surrounding fluid, the organized structure inside it, and then the movement returned. This time it was unmistakable. A small, rhythmic motion appeared within the developing structure. The technician measured it again. Then she changed the angle of the probe. The image became clearer. Dr. Harris leaned closer. He examined the visible anatomy carefully. The shape was no longer consistent with a simple mass. There were developing anatomical features. There was a recognizable body contour. And then the technician detected cardiac activity. Andrea stared at the monitor. Her eyes widened. "Is that a heartbeat?" The technician nodded. Andrea immediately looked at Lena. For 15 years, Andrea had watched this woman lie in the same kind of bed. She had watched her grow from a 6-year-old child into a 21-year-old woman without ever hearing her say what she needed. She remembered brushing Lena's hair, changing her blankets, talking to her when nobody else was around, telling her about the weather, playing the songs her mother used to love. And now, on a screen only inches away, Andrea was watching a second rhythm beating inside the woman she had spent half her life caring for. Her eyes filled with tears. "But she's been here all these years." Her voice broke. "She couldn't tell us." Nobody answered. Dr. Harris continued the examination. He assessed the surrounding fluid. He examined the placenta and repeated the developmental measurements. The findings were increasingly consistent with an ongoing biological process that had been developing for months. But the doctors still needed to establish exactly what they were seeing, how far along it was, and whether there were any complications. Andrea looked at the screen again. The movement continued, steady, rhythmic, independent of Lena's own heartbeat. She covered her mouth. All those years, all those mornings, all those times she had stood beside Lena and wondered whether the woman behind those closed eyes understood anything she was saying. Andrea reached for Lena's hand. "I've been here all this time," she whispered. Her thumb moved gently across Lena's fingers. "I should have known something was happening." Dr. Harris looked at her. "You couldn't have known from the signs alone." But Andrea couldn't stop thinking about the clues, the weight gain, the abdominal fullness, the unusual sounds, the discomfort during repositioning, things that had seemed insignificant when viewed separately. Now they carried a completely different meaning. The technician saved the images and began documenting the measurements. Dr. Harris remained focused on the monitor. The scan had given them a much clearer picture of what was happening inside Lena, but it had not answered every question. They still needed to understand the timeline. They needed to determine how Lena's body had reached this point without the usual symptoms being recognized, and they needed to understand why the changes had remained so easy to miss. Andrea squeezed Lena's hand. For 15 years, she had been waiting for Lena to give them some sign that she was still there. Now Lena's body had given them something else, a clue, a living, developing process that had apparently been unfolding silently for months. And as Andrea looked at the ultrasound screen, one question kept returning to her mind. But if the measurements were correct, Lena's body had been changing for nearly 8 months. And that meant the doctors now had a question they could no longer avoid. What had happened during those 8 months that nobody had documented? Dr. Harris returned to Lena's room with a folder under his arm. Andrea was still sitting beside the bed. She looked up immediately. "Did you find anything?" "Not much," he said. "At least, not at first." He opened the records on the desk. For several minutes, everything looked ordinary. Medication schedules, weight checks, physical therapy notes, skin assessments, feeding records, routine vital signs. There was nothing dramatic, no emergency, no unexplained hospitalization, no obvious event that could explain what the ultrasound had revealed. Andrea leaned over the papers. "So there's nothing?" "Not exactly." Dr. Harris turned another page, then another. He stopped. His finger rested on a nursing note from roughly 8 months earlier, the same period the ultrasound measurements had identified as the likely beginning of the biological process. Andrea watched his expression change. "What?" He slid the page toward her. The note was brief. Staff had documented that no menstrual bleeding had been observed for 2 consecutive cycles. There was no emergency associated with it. No fever, no abdominal crisis, no other obvious change. Because Lena couldn't report symptoms herself, the observation had simply been recorded and followed. But there was something else. A later note showed that the absence of bleeding had continued. Andrea stared at the date. "That was when it started?" Dr. Harris nodded cautiously. "It lines up with the ultrasound estimate." Andrea felt a chill move through her. For years, Lena's care had required staff to notice things most patients could describe themselves. Pain, nausea, dizziness, changes in appetite, changes in her menstrual cycle. Lena couldn't simply tell them when something felt different, so the nurses had relied on what they could see, and this particular change had been documented, just not understood. Andrea looked back through the records. The weight increase came afterward, then the abdominal fullness, then the episodes of discomfort during repositioning, then the unusual sounds. One clue after another. Nothing dramatic by itself, but together they formed a timeline. Andrea slowly lowered the papers. "We had a clue." Dr. Harris nodded. "A clue, yes, but not an explanation." That distinction mattered. The absence of menstrual bleeding could have many causes in someone with a severe neurological condition, including changes related to illness, nutrition, medications, or hormonal disruption. It wasn't proof of anything by itself, but now, beside the ultrasound findings and the estimated developmental timeline, it carried a very different significance. Andrea looked toward Lena. For 15 years, she had watched nurses document every small change they could observe. And yet the most important change in Lena's life had been hidden behind clues that looked ordinary when they appeared. Andrea reached for her hand. "I wish you could tell us." Her voice trembled. "I wish you could tell us when this started." Lena remained still. Dr. Harris closed the folder. The medical timeline was becoming clearer. The process had likely begun around 8 months earlier. The first corresponding physical clues were already in the chart. But one crucial piece was still missing. If the records had captured the first signs, what had happened during those earliest weeks that nobody had thought to investigate? Dr. Harris didn't close the records. Instead, he went further back. "If we're going to understand when this began," he said, "we need to know what Lena looked like before the changes started." Andrea moved closer. They searched through the examinations from the months before the estimated beginning of the biological process. At first, everything looked ordinary. Her weight had been relatively stable. Her abdomen had been described as soft and without obvious enlargement. There was no documented abdominal tenderness. No unusual swelling. No unexplained change in her condition. For the first time, the doctors had something they could use as a baseline. Andrea stared at the note. So she was normal? Based on this examination, there was nothing remarkable documented, Dr. Harris said. Then he turned the page. The next detailed examination was several weeks later. The wording was different, not dramatically, but enough to make him stop. Her weight had increased. Her abdomen was no longer described as completely unremarkable. There was a note about increased abdominal fullness, And another observation caught Andrea's attention. Lena had been more difficult to reposition. Andrea remembered that. She made those sounds that week. Dr. Harris nodded. The dates were beginning to line up. A documented normal examination, then the estimated beginning of the biological process, then subtle physical changes, then the absence of menstrual bleeding, then progressive abdominal enlargement, and finally, months later, the unmistakable findings on the ultrasound. Andrea looked at the timeline. For the first time, it didn't feel like a collection of random clues. It looked like a progression. Something had changed, then something else, then something else. And the changes had become more obvious only after the process was already well underway. But one detail bothered Dr. Harris. He pulled up the earliest examination again. If this was her baseline, he said, then whatever we're seeing now wasn't present at that point. Andrea looked at him, meaning it started afterward. That's what the evidence suggests. He wasn't willing to say more. The ultrasound could estimate development. The records could establish what had been documented, but neither could tell them exactly what had happened between those 2 points. Andrea looked toward Lena. 15 years earlier, she had been a 6-year-old child lying in this hospital. Now she was 21. And somewhere during those years, her body had continued changing in ways that Lena could never explain to them herself. Andrea reached for her hand. I keep thinking we should have noticed. Dr. Harris shook his head. You noticed what you could see. Andrea looked back at the records. But what we could see wasn't the whole story. No. He placed the final examination beside the ultrasound report. The difference was striking. The earlier examination showed no obvious abdominal enlargement. Months later, the ultrasound showed a fully developed biological process occupying the uterus. The timeline was becoming difficult to ignore. Whatever had begun during that narrow window had progressed quietly for months. And now the doctors had one final piece they needed to understand before they could reconstruct what happened. What could have happened during those first few weeks, when Lena still looked completely unchanged from the outside, but something inside her had already begun to develop. And before we continue, if you're fascinated by real medical mysteries like this, share this video and subscribe to this channel. And if you value these videos, there's a free link in the description and pinned comment that helps support the channel. Even if you've clicked it before, endeavor to click on it again with every new video you watch from this channel. Every bit of click helps us continue researching and telling these stories, and it's completely free. Now, let's continue. The room had become almost completely silent. Dr. Harris placed Lena's old examination beside the newest ultrasound report. On one side was the woman they had documented months earlier. Her abdomen had been unremarkable. No obvious enlargement. No documented tenderness. Nothing that suggested a major abdominal process was already underway. On the other side was the ultrasound. An enlarged uterus, a developing fetus, placental tissue, amniotic fluid, and unmistakable cardiac activity. Dr. Harris looked at the measurements one more time. Then he turned toward Andrea. We have an answer. Andrea's expression tightened. What is it? The doctor paused. He chose his words carefully. Lena is pregnant. Andrea didn't move. For a moment, the words seemed impossible to process. Pregnant? Dr. Harris nodded. The ultrasound is consistent with an intrauterine pregnancy. The measurements suggest she's approximately 8 months along, although we'll need additional assessment to establish the gestational age as accurately as possible. Andrea looked at Lena, then back at the monitor. 8 months. The number suddenly connected everything. The normal abdominal examination, the estimated beginning of the pregnancy, the missed menstrual bleeding, the gradual weight gain, the abdominal fullness, the difficulty during repositioning, the strange sounds, and finally, the movement Andrea had seen that morning. They weren't separate mysteries anymore. They were stages of the same biological process. Andrea's eyes filled with tears. For 8 months, she couldn't finish. Dr. Harris nodded slowly. The timeline is consistent with that. Andrea looked down at Lena's hand. She remembered all the mornings she had entered that room. All the times she had adjusted Lena's blanket. All the conversations she had carried on despite never receiving an answer. And now she knew that during those ordinary mornings, Lena's body had been undergoing one of the most profound biological changes a human body can undergo. Yet Lena had never been able to tell them. She had never been able to say that something felt different, never been able to report nausea, never been able to describe pressure or discomfort, never been able to tell anyone that her body was changing. Andrea wiped her eyes. How could she have been pregnant for this long without us knowing? Dr. Harris didn't answer immediately, because the diagnosis answered one question. It didn't answer all the others. Pregnancy explained the enlarged uterus. It explained the organized developing structure. It explained the cardiac activity. It fit the measurements. It fit the timeline. But it did not explain how the pregnancy had begun. It did not explain why the earliest signs had been so easy to miss. And it certainly did not explain the circumstances surrounding Lena's condition. Dr. Harris looked again at the old examination. The baseline was clear. So was the progression. But somewhere between those 2 points was a period the medical records could not fully explain. Andrea stared at Lena. For 15 years, she had waited for her to wake up. Now Andrea was facing something far more frightening. Lena was not simply a patient who had developed an unexplained abdominal enlargement. She was a 21-year-old woman carrying a pregnancy that had apparently progressed for months while she remained unresponsive. Andrea squeezed her hand. "We know what is happening now," she whispered. But even as she said it, she knew that wasn't completely true. They knew what Lena was carrying. They still didn't know how she had become pregnant in the first place. And that unanswered question was about to change everything. Andrea and Dr. Harris returned to the records. This time, they began with the exact period between Lena's last documented normal abdominal examination and the estimated beginning of the pregnancy. They went through the months slowly, one page at a time. Medication administration, feeding schedules, vital signs, physical therapy, bathing records, routine nursing observations. Most of it was completely ordinary. There were no unexplained hospital transfers, no major changes in medication, no documented abdominal injury, no emergency procedure. Nothing in the routine chart immediately explained how Lena could have become pregnant. Andrea let out a quiet breath. "So there's nothing?" "Not yet," Dr. Harris said. He kept reading. Then he noticed something. Not a diagnosis, not a medical event, a gap. One overnight period had medication and vital sign entries, but the usual detailed nursing narrative for that shift was missing. Andrea looked at the date. "How long is the gap?" "Several hours." "That's it? That's all we have?" Dr. Harris checked the surrounding pages. The previous shift had documented Lena's condition. The following shift had documented her morning care, but between them was almost nothing. Andrea stared at the empty space. Could the note have been filed somewhere else? Possibly. Dr. Harris didn't speculate. He checked the electronic record, then the paper chart. Nothing. He looked at the medication administration record again. The medications had been documented, so had Lena's vital signs. But the narrative explaining what happened during those hours was incomplete. Andrea felt uneasy. "Does that mean something happened?" "No," Dr. Harris said immediately. "It means we don't know." He paused. "And that's important." Andrea looked at him. "Why?" "Because we can't turn a missing note into a conclusion." He pointed toward the chart. "The pregnancy tells us that something happened biologically. The records may help establish when Lena was pregnant, but they can't tell us from this alone how that pregnancy began." Andrea nodded slowly. She understood. They needed evidence, not assumptions. Dr. Harris continued searching. They checked the staffing schedule. The overnight assignment was documented. They checked medication records. They checked vital signs. They checked the room assignment logs. They even reviewed whether Lena had been moved for any procedure during that period. Nothing immediately explained the missing narrative. Then Andrea noticed another detail. The morning nurse had documented that Lena's bedding and clothing had been changed earlier than usual. Andrea looked at the time. Why? Dr. Harris checked the note. There was no explanation. It could have been routine, a spill, a hygiene issue, a change in bedding for any number of ordinary reasons. There was no way to know. Andrea looked toward Lena's room. For 15 years, she had trusted the routine, the same medications, the same nurses, the same morning checks. The same quiet hallway. Now she realized how much of a patient's life could disappear between the lines of a medical chart. Dr. Harris closed the folder. We need more than these records. Andrea looked at him. What do we do now? We reconstruct the timeline from every source available. He began making a list. Staff schedules, medication records, vital sign logs, room access records, transport records, any documentation from that period that could establish who was present, what care was provided, and what happened during those missing hours. Andrea looked at the list. For the first time, the investigation felt bigger than a medical diagnosis. But Dr. Harris remained careful. They still didn't know what had happened. They didn't know when the pregnancy had begun with absolute precision. And they didn't know whether the missing documentation was significant or simply incomplete paperwork. All they knew was that Lena had been documented as having an unremarkable abdomen. Months later, she was carrying a developing pregnancy. And somewhere between those 2 points was a period the records could not fully reconstruct. Andrea took Lena's hand. We're going to find the missing pieces. Dr. Harris looked once more at the empty section of the chart. Because if the medical records couldn't explain how Lena became pregnant, what would they discover when they reconstructed everything that happened during those missing hours? Dr. Harris returned to the records the following morning. This time, he wasn't looking for another unexplained timestamp. He was looking for the person connected to it. The access log identified the employee as Daniel Mercer, a hospital care technician who had worked on Lena's floor for several years. Andrea recognized the name. She had seen him around the ward before. Nothing about him had ever seemed unusual. Dr. Harris opened Mercer's schedule for the night in question. His assignment was clear. He was supposed to be working in another section of the floor. But the access record showed his credentials being used near Lena's room during the same period when the nursing narrative was missing. Andrea stared at the screen. Could he have been sent there? That's what we need to establish. They checked the supervisor's records. No reassignment. They checked the shift change notes. Nothing. They checked the emergency logs. No emergency had required Mercer to leave his assigned area. Dr. Harris wasn't satisfied. Let's not assume anything yet. He pulled up Mercer's other activities from that night. Several entries matched his scheduled duties. Then came the unexplained access. Afterward, his records returned to normal. Andrea looked toward Lena's room. So he was nearby. The system shows his credentials were used at that access point. But that doesn't prove he entered Lena's room. Correct. Dr. Harris emphasized the distinction. An access record could establish that a credential was used. It couldn't establish what happened after the door opened. They continued. There was no documented procedure involving Lena. No emergency, no transport, no medication that required Mercer to enter her room. Nothing obvious. Then they found another detail. Mercer's shift ended earlier than scheduled that morning. Again, there was no corresponding explanation in the records. Andrea felt the familiar uneasiness returning. That's strange. It is. Could it still be completely innocent? Yes. Dr. Harris looked at her. And that's exactly what we have to determine. They searched further. Rather than examining only the critical night, Dr. Harris pulled up every recorded access involving Mercer over the preceding months. Most were completely ordinary. His credentials appeared when he was assigned to that section. His care activities were documented. His movements made sense. But one earlier entry caught their attention. Again, his credentials had been used near Lena's room. Again, his official assignment placed him somewhere else. And again, the corresponding nursing documentation was incomplete. Andrea looked at Dr. Harris. That's two. He nodded. Two unexplained events, both involving the same person. Yes. Andrea swallowed. The discovery didn't prove what she feared, but it changed the question. They were no longer investigating one unexplained access event. They were investigating whether the same employee had appeared near Lena's room during more than one undocumented period. Dr. Harris printed both records. Then he placed them side by side. Different dates, different shifts, same employee, similar discrepancy. Andrea stared at them. What are the chances that's just paperwork? I don't know. He closed the file. And until we know, we shouldn't call it anything more. Andrea nodded, but as she looked toward Lena's room, one thought wouldn't leave her mind. If Daniel Mercer had a legitimate explanation for both entries, there should be a record somewhere that explained it. So why did the records repeatedly place the same employee near Lena's room when his official assignment said he should have been somewhere else? Dr. Harris began with the simplest possibility. Daniel Mercer had been reassigned. If that were true, the discrepancy could disappear immediately. They checked the supervisor's records. Nothing. They checked the staffing system. Nothing. They checked shift change documentation. Still nothing. No reassignment had been recorded on either date. Next came another possibility. Mercer had been responding to an emergency. They checked incident reports. No emergency, no rapid response, no patient collapse, no urgent call documented during either period. Then they considered a routine explanation. Perhaps Mercer had been delivering supplies. They checked supply logs. Nothing corresponding to either access event. Perhaps he had been assisting another employee. They checked the available care notes. Again, nothing. Dr. Harris leaned back. That's several innocent explanations we've tested. Andrea looked at him, and none explains both events. Not yet. He opened the access system's technical report. Could the wrong door have registered? Could the system have duplicated a badge scan? Could another employee have accidentally used Mercer's credentials? The hospital's technical review found no evidence of a system malfunction. The credentials were valid. The timestamps were consistent, and the two events had occurred months apart. Andrea's voice became quieter. So the records are real. The access records appear reliable. But we still don't know what he did. Correct. Dr. Harris returned to the care documentation. That was where the picture became more troubling. On both dates, the nursing narrative was incomplete during the same general periods in which Mercer's credentials appeared near Lena's room. That still wasn't proof of misconduct, but it meant the discrepancies weren't isolated to a single computer entry. There were now multiple records that failed to line up. Andrea looked at the two dates. Then something occurred to her. What about the pregnancy timeline? Dr. Harris didn't answer immediately. He opened Lena's obstetric measurements. The estimated gestational age placed the beginning of the pregnancy within a window that overlapped one of the periods they were examining. He was careful with the wording. Ultrasound dating gives us an estimate. It doesn't tell us the exact date conception occurred, so we can't say it happened that night. No. Andrea nodded. But the timing makes the records more important. Yes, that was all he was willing to say. The evidence was beginning to converge. But it still wasn't enough. They couldn't establish conception from an access record. They couldn't establish an assault from an incomplete nursing note. And they couldn't establish paternity from the timeline. There was one thing that could answer a different question. Who was the biological father of Lena's baby? Dr. Harris looked at Andrea. If investigators can establish paternity through appropriate DNA testing, that could give us another independent piece of evidence. Andrea understood immediately. And if the father is someone who had access to Lena, we would still need to investigate the circumstances. But we'd know who to investigate. Dr. Harris nodded. Exactly. Andrea looked through the glass toward Lena. For the first time, the investigation had reached evidence that existed completely outside the hospital's access system. The pregnancy had created something the original medical records could never provide. a biological link. But before that evidence could be used, the baby would need to be delivered, and the appropriate forensic process would have to take place. Dr. Harris closed the file. Until then, Daniel Mercer remains a person of interest. Not a perpetrator, not guilty, just someone whose movements and records required explanation. 3 weeks later, the baby was born. Andrea helped in delivering Lena of the baby. The next day, Andrea looked at the photograph of Lena's daughter on the desk. The answer might already exist in her DNA, but when the paternity results finally arrived, would they point back to the same employee whose movements had never quite matched the hospital's records? The paternity results arrived after the baby was born. Andrea was sitting beside Lena when Dr. Harris entered the room. He was carrying a folder. He didn't speak immediately. Andrea looked at him. What did they find? Dr. Harris sat down. The DNA testing established the baby's biological father. Andrea's heart began pounding. Who? He opened the report. Daniel Mercer. For several seconds, Andrea couldn't speak. The same employee whose credentials had appeared near Lena's room. The same employee whose official assignments didn't match those access events. The same employee connected to 2 periods of incomplete documentation. Now there was a biological connection, but Dr. Harris remained cautious. The DNA establishes biological paternity, he said. It does not, by itself, establish the circumstances under which the pregnancy occurred. Andrea nodded slowly. So they still need everything else? Yes. And they had it. So they called for investigators from the police department. Investigators compared the paternity result with the reconstructed timeline. They reviewed Mercer's documented assignments, the access records, the unexplained entries, the missing nursing documentation, the periods in which his credentials had been used near Lena's room, despite no documented reason for him to be there. They examined whether there were legitimate explanations for those events. None adequately accounted for the full pattern. The DNA did not stand alone. It became another piece of evidence within a much larger investigation. Daniel Mercer was interviewed. The investigators confronted him with the timeline, the access records, the discrepancies, and finally, the paternity result. The details of the investigation were turned over to the appropriate authorities. Mercer was subsequently arrested and charged in connection with the sexual assault of Lena, with the case proceeding through the legal system. Andrea didn't celebrate. There was nothing to celebrate. She simply sat beside Lena. For 15 years, Andrea had believed the hardest part of caring for Lena was watching someone she loved remain unable to communicate. Now she understood there had been another burden. Something had happened to Lena while she was unable to speak for herself, and Andrea hadn't known. She closed her eyes. I should have seen something. Dr. Harris shook his head. You saw what you could see. Andrea looked at him. You kept asking questions when the first answers weren't enough. He placed the file on the table. That helped. Andrea turned toward Lena. Her face was peaceful, unchanged. There was no miraculous awakening, no sudden words, no convenient moment in which Lena could explain everything that had happened. Her prolonged neurological condition remained. But her circumstances were different now. Her daughter was receiving appropriate care and protection. Lena's medical team continued her long-term treatment. The hospital's handling of her care had been scrutinized, and the investigation had moved beyond suspicion into a formal legal process. Andrea picked up the photograph of Lena's daughter. She placed it beside Lena's bed. Then she took Lena's hand. Your little girl is safe. She paused. And people know what happened. There was no response. Andrea didn't expect one. She had stopped measuring Lena's worth by whether Lena could answer her. She remembered the first morning of the entire ordeal, the sheet, the strange change in Lena's body, the shock, the questions. For 15 years, Andrea had walked into that room believing she was simply caring for someone who couldn't tell her what she needed. Now she understood the deeper truth. Lena's silence had never meant that her life was empty. It had never meant that her body didn't matter. and it had never meant that she didn't deserve someone willing to keep looking. Andrea adjusted Lena's blanket. Then she looked once more at the photograph beside the bed. A mother. A daughter. Two lives connected by a story Lena could not tell herself. Andrea squeezed her hand. For 15 years, I talked to you even when you couldn't answer. Her voice broke. I'll keep talking. She stood beside the bed for another moment. The room became quiet again. But this time, the silence felt different. Because the mystery was no longer hidden inside Lena's silence. The truth had been reconstructed from the evidence, and the woman who could not speak for herself had finally been heard. Silence had never meant absence. It had only meant that someone else had to listen carefully enough to find the truth. If you made it all the way to the end, thank you. These stories take a lot of research to put together. If you'd like to support the channel, you'll find a free link in the description and pinned comment. Checking it out helps support future videos. Even if you've clicked it before, endeavor to click on it again on every new video you watch from this channel. Every click allows us to keep bringing these cases to the channel, and it's completely free. If you learned something from this case, like, share, and subscribe for more real medical stories. And if you chose not to subscribe, drop a comment and tell me what would make these videos better or what you learned from it. I read far more comments than you might think. This is Hidden Pathogens. I'll see you in the next diagnosis. Good night.
This is Hidden Pathogens?